Let's talk about the diagnosis of post-traumatic stress disorder. My name is Sophie. I'm a licensed clinical social worker and community mental health therapist. When we're talking about anything trauma-related, we need to look at this from the lens of the individual. Just because a person experiences an event that one person might think is traumatic does not mean that it causes post-traumatic stress disorder in a person. Presence of the disorder is based on the disruption to the life of the person. So we can break post-traumatic stress disorder down into two parts. We can look at the symptoms that we can observe, and we can also look at the things, the situations, the circumstances that can result, not always, but can result in post-traumatic stress disorder. So let's start with the symptoms. Emotional and physical dysregulation. Mood swings, crying spells, low mood, feeling out of control of your mood, not being able to pick up on your physical cues like hunger or sleep or thirst or going to the bathroom or your need to socialize with other people. Intrusive thoughts of re-experiencing the trauma, visuals, sounds, smells, being triggered back to the experience of the trauma in some way, a re-intrusion, and some sort of re-experiencing of the trauma. Sometimes this happens during nightmares, sometimes this happens with flashbacks during the day. Sometimes it is a result of an environmental trigger like a sound or a smell or a person. Nightmares are a common symptom of post-traumatic stress disorder. Hyperarousal, not being able to settle, being anxious, being worried, being irritable, being restless, and not really going away, that feeling not going away. Post-traumatic stress disorder can result in traumatic grief and attachment difficulties. People who have experienced trauma and develop post-traumatic stress disorder might have trouble finding supportive relationships, keeping relationships in their life. They might have difficulty with romantic relationships. They might struggle to work under a supervisor. They may have conflict with their family. They have a hard time establishing those relationships. A lot of it is due to mistrust, suspiciousness of others, not knowing how to form attachment, and having very low self-worth, thinking that you don't deserve relationships or that you can't get the kind of people in your life that you need because you haven't had them before. People with post-traumatic stress disorder might engage in numbing behaviors such as substance use or sleeping or gambling or any other kind of behavior that someone would do to try to numb their feelings of pain and replace it with something that is more pleasurable. Avoidance behaviors, avoiding talking about it, avoiding things that remind them of the situation, avoiding triggers, avoiding people, avoiding bringing it up, pretending like everything is normal, not wanting to go into it, not wanting to explore the past, shutting down when someone tries to talk about it with you, avoiding care such as mental health care, avoiding physical care. Dissociation, hard time focusing, poor memory, low focus, unable to stay present in the moment because you are distracted with intrusive thoughts or re-experiencing or flashbacks, or maybe your sleep is impacted because you're having a lot of nightmares, but dissociating in your everyday life and unable to focus on the world around you or not wanting to focus on the world around you. We see patterns of persistent negativity with people with post-traumatic stress disorder, such as persistent and exaggerated negative beliefs about the self. I caused this, I'm responsible, I am a failure, I'm unworthy, I'm ugly, I'm undeserving, I caused this to happen, it's my fault, I should have done this different. Persistent negative emotional state and inability to experience pleasurable emotions, even if they're in a situation that they would enjoy otherwise. They have a hard time feeling those pleasurable emotions because they're crowded with negative associations to the trauma, or they feel like they don't deserve to experience happiness after what they went through. This can result in irritability, if you don't have supportive relationships, if you aren't able to manage your bodily needs, and if your mind is plagued with re-experiencing the trauma. It can lead to short temper, it can lead to snapping or lashing out at people, even when you don't want to. We also see as a symptom of post-traumatic stress disorder reckless and impulsive behavior, taking drugs, relationship behavior, violence, aggression, lack of remorse, limited ability to understand the consequences, not caring about what would happen anyway, and feeling like your life has no worth, so it doesn't matter if things go wrong. We see hypervigilance as well. Maybe you are avoiding situations that made you feel traumatized, but in addition to that, you are also scanning your environment when you are out, looking for things that might be a trigger to a past experience, or worrying that you might see someone or feel something or be activated in a way and not be able to manage. So this leads to people either being super hyper vigilant in their environment, or it leads to people avoiding external stimulation altogether. You can see people develop agoraphobia or severe loneliness, or periods of months or days or weeks where they're not talking to anybody, not leaving the house.